Healing yourself emotionally is only metaphorically possible. Now, what do I mean by this? Healing yourself emotionally implies that if one is experiencing undesirable or unpleasant emotions, then the process of feeling better is a process of healing. Now, this is medicalized language. I would argue that emotions are not illnesses. Therefore, they can only be healed in a metaphorical sense. If a joke is a sick joke or a dirty joke, you don't take a sick joke to the hospital or a dirty joke to the dry cleaners. If emotions are not illnesses, then to talk about healing emotions, or the idea that emotions could be ill or sick, is therefore analogous to talking about a dirty or sick joke. The brain can be ill, the brain can have sickness, whether that's a viral infection or a tumor or a stroke, so on and so forth. Humans can indeed have distressing emotions. People can feel worry or stress, or sadness or despair, or be thinking about traumatic experiences over and over. So then how can we feel the way we want to feel? And if it's not healing emotionally, then what is it? There are many ways to feel good or to reduce stress. People can seek to reduce their stress through the use of psychiatric drugs. My understanding is that psychiatry, the word itself, sort of means to heal the mind. The mind cannot be ill or sick. The mind is intangible. So to speak of a mental illness is a metaphor. A brain illness or a neurological illness can literally exist. We can objectively measure brain illnesses, neurological illnesses. And if we can't measure them through objective medical means, then if medical doctors declare them as diseases, then they are practicing fiat medicine. Just like how we have fiat currency. $100 bills and dollar bills, they have value because the government declares they have value. When in fact, paper money is in fact ink on some mixture of paper and cotton or whatever the bill is made of. So if we want to heal ourselves emotionally, well, we can do things that help us feel good. And we can solve problems in living that are contributing to emotional distress. According to psychiatrist Thomas Szasz, psychiatry is the medicalization of problems in living. So if we talk about somebody having anxiety disorder or depression or psychosis or so on and so forth, they may have social problems, economic problems, family problems, relationship problems, economic problems, so on and so forth. And just like an art forgery, Dr. Szasz uses this analogy in the book Psychiatry, the Science of Lies. An art forgery can look almost identical to a real art masterpiece. One could even say that the forgery is more beautiful or more artistic than the original masterpiece it is meant to replicate, possibly. Regardless of how good a forgery is, though, it will never actually be the original piece of art. Conceptualizing mental illness is sort of like this in relation to bodily illness. Objective medical diseases have objective measurements, and then fiat medical diseases, which is what psychiatric diagnoses are fiat medicine and will never actually be objective bodily diseases unless they are proven to be such. And once that is the case, a mental illness or a psychiatric diagnosis will no longer be a mental illness or psychiatric diagnosis. It will be a neurological condition. A neurologist would treat it rather than a psychiatrist. So when thinking about healing yourself emotionally, I think all this is important to keep in mind. And you are very welcome to disagree with this or conceptualize this in your own way. And I do have a master's degree in psychology and have worked in various areas of the psychological industry for a number of years. So I'm not totally just speaking without knowledge or experience. Now, trauma, like abuse that people experience, where people could then later have distress, then healing oneself emotionally in relation to the distressing feelings of the trauma, to my knowledge and understanding, is still a metaphor. Again, unless there is some neurological abnormality that could be measured objectively, which perhaps in the future that'll be the case. But until then, the underlying question of how can one feel better if one is experiencing distressing emotions in relation to past distressing events, one could see a priest or a pastor or a spiritual leader or a psychologist or a psychiatrist, or talk with family or friends. One could get so busy in life and have such joyous things they enjoy doing, they don't have any time or energy to even think about the past traumatic events that have happened. Some people have horrible things happen to them, and for the most part, they move on with life and don't have a significant amount of distress in relation to it for whatever reason. Perhaps that is the minority of individuals, depending on the nature and severity of a traumatic happening. Regardless, healing oneself emotionally, if conceptualizing the language in that way is helpful, by all means, if it's not broke, don't fix it. But if rather than thinking about healing oneself emotionally, one conceptualizes it using language more in terms of feeling consistently better emotionally, or, sleeping better and doing whatever needs to be done to make that happen. Basically, what I'm suggesting is to demedicalize the language. And I personally only think that is important because I believe that medicalization can have unintended consequences. The logical outcome of medicalization is the use of psychiatric drugs. And if people find psychiatric drugs helpful and they can get them prescribed and want to ingest them, by all means, please do so. Books like Anatomy of an Epidemic by Robert Whitaker point out the potential unintended consequences of psychiatric drugs. For example, if one has, distressing feelings related to past trauma and one is prescribed benzodiazepines to reduce the distress and feel better, that can help temporarily. But with benzodiazepines, there can be rebound anxiety. And also, my understanding, to the best of my knowledge, benzodiazepines can also have side effects, which can even lead to happenings like akathisia. So again, I won't make this much longer. If you find speaking and thinking in terms of healing yourself emotionally helpful, please keep doing so. However, if you find demedicalizing language to be helpful and trying to think of things more in linguistic terms that are perhaps more accurate and true to the nature of the mind and emotions and the nervous system, then please do that. I'm sort of a linguistic libertarian in many circumstances, whether you're thinking words to yourself or so on and so forth. Regardless, I believe that God's will for all of us is perfect happiness, so I hope you can experience inner and outer peace and perfect happiness and joy and equanimity, regardless of how you get there, as long as you're not breaking just laws or infringing on anyone's rights. So whether you're trying to heal yourself emotionally or just feel good in life and consistently feel good emotions and reduce stress and activate unlimited joy, I hope you are successful. Limitless blessings, limitless peace, and limitless serenity.